Questions for Dr. Campbell? Well, let me start with one on the mortality data that you gave. Were of course very interesting to a health-based group. I didn't see any uncertainties or in the data that came through. It came through pretty quickly. Well, what kind of error bars do you have on that? Are they relatively large, relatively firm? Are those differences in the usual statistical significance?
Yeah, that's a great question. We don't have error bars at this point. I just threw out a couple numbers there to give a sense of the potential order of magnitude. The goal, though, is to replicate these preliminary results for a range of different spatial scales for the population data, as well as different references for the health response functions, as well as different data that we're gathering now to describe the baseline conditions. There will also be significant contributions to the uncertainty from the different emissions that we put in as input for the regional air quality model. We have different burned area estimates, different emission factors, and different fuel loadings depending on whether we use top-down or bottom-up data or a variety of other data sources. So the short answer is we don't have uncertainty now results, but we do have methods to quantify that uncertainty, and those are important next steps.
Thank you. Dr. Portier.
Elliot, this is Chris Portier from CDC. Elliot, the climate forcing functions you used for the burning of the sugarcane stalks, et cetera, did that include carbon black?
You know, it only includes carbon, which is one of the weaknesses of that analysis. So that was just there have been some very kind of simple ballpark estimates on the climate forcing of black carbon that have been published. And if you apply those to the range of emissions that you might be seeing from this pre-harvest burn, you can potentially exceed these thresholds for life cycle greenhouse gas emissions. But what's really needed is to run a regional climate model for this domain, because the climate forcing from these species varies so much depending on the domain, the time of year, the timing of the emissions, all these kinds of factors. So, you know, we showed that there's potential for exceedance to occur if you start to account for these regional climate forcing get from black carbon emissions, but definitely the jury's still out there.
Dr. Santos-Burgoa.
Yes, Carlos Santos-Burgoa from the Pan American Health Organization. Very interesting data and very relevant for the from the regional perspective. On your recommendations, I didn't see anyone related to process changes in the sugarcane ethanol production process. Are there any opportunities that you can foresee on process changes that can improve the emissions, can improve the situation, or it is an just or all or none situation?
That's a great question. Here we're just trying to attribute what the impact is, essentially based on the status quo, but obviously things are changing, and in fact we have to make recommendations about changes that really enhance the sustainability of these biofuels. Right now, one of the trends, at least in Sao Paulo state, is to shift pre-harvest burning to a more mechanized approach to harvesting that doesn't necessarily require the burning. And so we've seen a pretty dramatic shift in the last decade, moving away from some of this pre-harvest burning. So the most recent, at least top-down data from Landsat, which is probably pretty good, shows that about half of the lands are burned where they previously weren't. So incentives to continue to move towards mechanization and away from pre-harvest burning are a great idea, and Brazil's doing has a voluntary program that's trying to move towards those better cultivation approaches. But it's unclear, outside of Sao Paulo State, what the future trends would be if sugarcane cultivation expanded rapidly to try and meet demand for biofuels for basically export of biofuels. And so finding cultivation practices that work in other domains and policies that work in other domains to try and minimize that burning would be a priority. Those are direct emissions from the pre-harvest burning. The indirect land use emissions, which we also show to be a potentially large driver for regional health and regional climate impacts. I'm not as familiar as what the potential solutions are there, but certainly in general, working towards using lands that aren't currently or potentially useful in the future for food is one way to get around that. Although cultivating biofuels crops on those lands could be a challenge too. But yeah, it's a great question. Thank you.
Good. Well, thank you. I've got two questions just to get sort of more discussion going as we've gone through the day. One, I'll just let you know, but Ken, I'm going to follow up on something that you said, but first I'll follow up on something that Dr. Campbell said. But what you said was that basically that it's not been all that easy to get considerations of air pollution into these discussions. Perhaps you didn't phrase it quite like that, but what could you said you're interested in the interface between policy and energy. What do we need to do to get these kind of air pollution considerations in there? But before we go there, and this is much for Al McCartland perhaps, Elliot started us off by saying that residue-based ethanol in Brazil has small impact, that's being exported to the U.S., has small impact on U.S. energy security, but if it was used for electricity in Brazil, it would have massive impact on Brazil energy security. And, you know, I've been tuned to listening to economists immediately jump up with a statement like that and say, well we just don't have the economics right. We're not pricing energy security appropriately. Is that right, Al? Is there something that we ought to be doing to so that these kind of observations that Dr. Campbell has just made aren't just so obvious that there's such a major distortion there? And I'm sorry I brought you to get up after you. I know you've got some knee problem.
Actually, EPA did do with Oak Ridge National Labs literature or research. We do include an analysis of energy security in the ethanol regulations that when we set a mandate. The biggest one isn't really energy security, but there's folks at Oak Ridge that modeled OPEC's behavior on the price of oil. So if we can reduce our consumption of oil and demand for oil, that lowers the world price of oil, and we enjoy a price break on all the oil that we do buy. You know, what we call the inframarginal barrels that we import from OPEC and else. So, and then there's some other security benefits about how the economy is vulnerable to the price of oil and military expenditures in the Gulf, et cetera. So that's considered for the U.S. And it's frankly isn't a trivial number if you look at it for the U.S. So I was struck by that as well. I'm not familiar enough with Brazil. Howard Gruenspech talked about how we actually ship corn ethanol to Brazil and import sugar ethanol because EPA considers sugar ethanol an advanced fuel, and so it qualifies to reach that mandate where corn ethanol doesn't. Really, Brazilians, I guess, don't care, given it's chemically the same. So, so it's a good question. It might depend on where the Brazilian, I know they have a lot of hydro, so there might be a depend on where they're getting their marginal electricity as well, and if they're importing that, maybe they're vulnerable to those supplies. But it's a good thing to look at.
Don't go away. Just to follow up, you mentioned Dr. Gruenspech this morning. Did I understand him to say in what you just said that if you drop the price of oil on the market, there'd be less of a push for biofuels? Basically, that's what Dr. Hashim told us about Malaysia, that the price differential is important there. So if oil prices come down, is there less of an incentive to develop biofuels?
There is. In fact, well, biodiesel, for example, wouldn't be made by the market without a mandate because it costs more. But obviously, if the price of biofuels, or sorry, the price of diesel fuel went up a whole lot, suddenly biofuels, I think, would come in on their own without a mandate. But we wouldn't see that right now at current prices. So there's sort of a supply effect and a demand effect, right? So there's, for our purposes, if we had no mandate for corn ethanol, we would be meeting that demand for gasoline with other octane enhancers or other, as Howard described, and that means we would be importing more, everything else equal or constant.
Okay, well, thanks. Let me turn this over and ask if you, Ken, if you've thought through what is it that we can do to, or anyone in the audience, what is it that we can do to do a better job of getting air pollution or other of these health issues in front of this discussion that's making major decisions as to the future fuel supplies in the U.S.?
Well, that's a good question. Bernie, you and I go back far enough where CO2 wasn't even considered an air pollutant. You remember that? In fact, it's still, I have a hard time talking about that as an air pollutant because so much emphasis has been focused historically on the criteria pollutants. And with respect to vehicle emissions, much of that has been focused on ozone problems, urban ozone problems in the U.S. and other cities. So how do we, first of all, get greenhouse gases to be considered and associated and evaluated as air pollutants in their own right? I think maybe that's the first step. But then I'm thinking the whole concept of life cycle assessments has become pretty popular these days. In fact, it's mandated now by certain regulatory agencies that some form of LCA must be done to evaluate the broader impacts of fuels or other technology introductions. And, you know, that has been focused on, life cycle assessments have been focused on greenhouse gases and on energy balances, but they've not been focused very much on, well, I'd say mobile source air toxics, discrete elements that fall outside those broad categories. So, for example, I'm thinking agriculturally based feedstocks that go into biofuels have a whole range of other emissions that we don't always think about, and you know, some are rather obvious. You still use quite a lot of diesel fuel burning in tractors and combines and other equipment in the agricultural world. But you have other things such as tremendous amounts of ammonia are used in that process. LPG, liquefied petroleum gas, is used a lot in drying of grains. So those sorts of life cycle emission impacts, not just for the greenhouse gas part, but the actual toxic or discrete chemicals of concern, is something that hasn't gotten much interest. Maybe that's someplace to look at.
Dr. Ghidotti?
Thank you. I wanted to approach your rhetorical question head on, which is how can we persuade decision makers and especially the economists that advise them to how why air quality needs to be important on the agenda and translate it into a serious policy concern. I think that this is that air quality is one of a class of health-related issues that traditionally have been marginalized, in part because although economists will kind of pay lip service to issues of health and productivity, I'm not sure that current economic theory really believes it. So what we tend to see is person years of life lost and issues made on a humanitarian grounds and so forth, which in development economics doesn't compute, because you're dealing with with figures that imply that many people are going to be subtracted from a labor market that is already glutted with free labor, or removing individuals such as children who are not in the labor market and aren't going to be economically productive. So I think that the hole in the donut in all of this is a closer relationship between health and productivity and economic development. And that's true for air quality, but it's also true for many other different dimensions of the health issues. Some progress is being made in this area in health and productivity studies of the type that are being done in industry to try to relate health promotion and so forth to productivity. But that so far has been very narrow and very rich, country-oriented. I think we need a far more robust economic approach.
Okay, thank you. Other comments or questions? I would point out that Dr. Campbell's presentation included his looking at mortality from ozone from particulates in a way that's becoming, that data is becoming far more robust and far more usable in these kind of analyses that Dr. Campbell did. So I think it's an excellent approach to this. I'm sorry, I didn't see.
I jumped up. I was waiting for Al to get up, and he didn't, so I figured I better do it. All due respect to the last speaker, most of what he said is really quite wrong from an economics perspective. The environmental economics community, cost-benefit analysis, OMB, all the work that's done through Al's shop at EPA would never think about valuing health in the way that was described. We know that it is absolutely wrong to think about the benefits from loss of life or illness as being something as simple as lost life years or lost productivity. It's wrong from an economic analysis perspective. It feels in the gut wrong, and it is wrong. So I don't want to give you a big, long lecture, but that notion is really not an accurate depiction of the state of the field. What is much more accurate is that benefits to improved human health are very well understood as belonging in cost-benefit analysis. Al's shop has done huge work on it. There's an enormous literature that does it. If you're talking to folks that don't understand that or argue against it, please tell them to talk to me or Al or somewhere else, and we'll point them to the relevant literature. But no good cost-benefit analysis would use those sorts of ways to value human health. It's super important, and it goes big time on the balance sheet of any reasonably done benefit cost analysis.
Good. Well, I'll finish then by giving an anecdote of 40 years ago at OMB as a young investigator being asked to talk about sulfur dioxide, and that data pointed out that infants had also died in the London epidemic, and was asked by the OMB economist whether they were male infants or female infants. And when I looked horrified, and along with David Rawl and Norton Nelson who were there, asked why would that be a question, it was pointed out that females did not contribute through their lifespan to the gross domestic product, but males did. So OMB has come a long way. Thank you. We'll resume at 3 o'clock.